As part of Labor's suite of election promises in the health portfolio, then Shadow Minister and now Minister for Health Ryan Park committed to establishing a special commission of inquiry into healthcare funding. This commitment came following a recommendation in Reform Critical, a Fragmented Health System at Breaking Point, which explored the state of the health system, declaring it a crisis. The report was released in February 2023 by Impact Economics and Policy, significantly with support from the Health Services Union New South Wales ACT and Queensland branches. The report noted that although many reviews of the health system have been completed previously, none have taken an all-encompassing approach. Why is this inquiry so critical? Our health system suffered under 12 years of the Liberals and Nationals in government. These conditions, plus the pressure of carrying us through the pandemic, led to an extreme strain on our health system. So, just 5 months into government, back in August 2023, Minister Park fulfilled the election promise and established this independent inquiry into healthcare funding. Since then, the Commissioner of the inquiry, Mr. Richard Beasley SC, as well as the expert panel he established and the inquiry team assisting with the proceedings, have been working on this matter. In the meantime, the Minns Labor government has also been hard at work. We've slashed the elective surgery waiting list from 14,000 down to 3,500 in 1 year. We have delivered record pay rises to health workers, and we are working hard to rebuild our essential services. For the inquiry, the terms of reference are very detailed, but ultimately it sets out to consider whether health funding is being used in the most impactful way. How can it be improved, as well as the effectiveness of New South Wales Health itself in terms of delivering for patients and staff and its governance and accountability structure. 12 hearings so far have been held across the state, including here in Sydney, Wagga Wagga, Dubbo, Broken Hill, Batemans Bay and Tamworth. In addition, more than 200 submissions authored by various local health districts, doctors, service providers, MPs, professional organisations, unions, other experts and New South Wales Health have been made public. Gerard Hayes AM, Secretary of the Health Services Union New South Wales, ACT and Queensland branch, gave vitally important evidence at the 17th of October 2024 hearing of the inquiry, alongside Shay Candish, the General Secretary of the New South Wales Nurses and Midwives Association, and Andrew Holland, the Executive Director of the Australian Salaried Medical Officers Federation. In the hearing, Gerard spoke about the importance of the inquiry to identify waste in the budget so it can be redistributed to parts of the system that need it most, and raised the concerns and experiences of his members, including, in particular, the need to modernise awards, saying they can make them, and I quote, more efficient, more productive, better outcomes for the community. This is supported by previous evidence to the inquiry, including by Dr. Dustin Hulse, the Division Secretary of Strategy, Research and Projects at the HSU, as well as the HSU submission to the inquiry, which provides a number of recommendations on how to improve our health system, informed by quantitative and qualitative surveys and direct interviews with their members. In summing up their submission, it reads, and I quote, "Reform is critical, safe, timely, equitable and accessible healthcare is the reasonable expectation of the people of New South Wales and of committed, passionate and highly skilled health workers. I look forward to seeing the final report for this very important Minns Labor government initiative." Madam Deputy President, once again an example of this government making good on election commitment and showing how valuable our affiliated trade unions are in consulting on how to deliver better outcomes for the New South Wales taxpayers. In this particular situation, the health budget, which takes such a big proportion of the New South Wales state budget, We've got to find better ways of using that money effectively in the health system, and this is a great way to do it.